Okay, so my name's Alyssa. I will be doing the Lantus sub-Q administration. So we're going to start with, we're going to check the physician's order. I have the physician's orders and the drug labels and the armband here. We're going to check the physician's order with the MAR and make sure everything matches. We're going to check patient allergies, patients allergic to aspirin and penicillin. We're going to check for any contraindications for giving the med before we go in. We're going to check lab values in the documented assessment, and the blood glucose is 89, so that's in the normal range. And then we're going to go ahead and gather our supplies. We're going to use the sodium chloride, but in a real situation, we'd be using the insulin syringe, the U100, with the bottle of Lantus insulin, the U100 that matches. So all the supplies are here. This is the insulin syringe. I've unlocked the cart to grab the meds. There's no drug calculation needed because it's just 30 units of insulin. It's done. So I'm going to wash my hands and then get ready to prepare my supplies. So when we're going to draw up 30 units of air, which you can see here. I'll put my gloves on, even though we don't have to do it till later. But I'll do it now. Use the alcohol prep to clean the vial really good. And we would check the date opened when we did it, and it says March of 2021 is the expiration. We use that as the date opened. Okay, I have the 30 units of air. I'm going to do my first check with the MAR Lantus U100 insulin. The expiration date is 1 of 2022. Take the cap off, inject air to air. Okay, and then we flip the vial over. Draw up the 30 units, being careful not to touch the inside of the syringe because it's sterile. Make sure we flick the bubbles out, roll out. Recap the needle just until we go to give the injection. So I'll show you the So there's the 30. And then since I'm drawing them up, I'll do my second check with the MAR before I go in. It's 30 units of Lantus U100 insulin, expiration date 1 of 2022. So now I'm going to re-wash my hands, put my gloves on, and go into the room, identify myself. Hi, I'm Alyssa, I'm your nurse today. We're going to be giving you your insulin sub-Q injection in the back of your arm. Your insulin's for your diabetes, that would be the explanation. They understand it, make sure they understand why they're getting the medication. Provide privacy, identify the patient's name and date of birth. We have Mary Johnson, date of birth 11/22/1953. So we would get ready to do our third check on the patient med. It'd be 30 units U100 insulin Lantus, expires 1 of 2022. I would assess the patient their pain and the injection site before giving it. They have no pain, the injection site looks fine. In order to get this injection in the back of the arm, you'd look for the elbow, one hand here, and then the top of the humerus at the acromion process, excuse me, and you do a hand here. It'd be about the middle third of the arm, not too far back where you hit the nerve, but make sure you get the sub-Q fatty tissue. So I'm going to prep the injection site. We're going to use alcohol prep, circle it around the back of the arm, about 2-inch diameter. We would use a new alcohol prep, but I'm trying to save supplies. Get your needle out. Go ahead and uncap it. We would let it dry and get ready to give the injection. Your bevel needs to be up, and I would move this pull the skin taut and at a 45-degree angle go in, tripod, give the injection, pull the skin taut, pull it out. And for saving supplies, we're going to recap it, but you would never recap a needle. It would go in the sharps container. Assess the site, blot any blood, make sure the patient, check them for their comfort, put them in the position of comfort, assess the site, and then you would go ahead and discard of the needle in the sharps container, take gloves off, discard of soil supplies, go wash my hands, and then I would document the medication given. The more it would be the drug name, it would be insulin, the date given, the time given, which would be the hour of sleep or in the evening, say it's 2200, 10 o'clock p.m. So the site would be we're going to do the left back of the arm, upper arm, your initials, okay, and then we would go ahead and come back in 30 minutes and check the patient's condition, make sure they're still doing all right, and that would be it.